Good morning, everyone. My name is Alessio Gallucci, and this is my poster for the Artificial Intelligence for Healthcare Application workshop. The title of my work is Don't Tear Your Hair Out, Analysis of the Impact of Skin Hair on the Diagnosis of Microscopic Skin Lesions. So the title is divided in three parts. The application of the work is the diagnosis of microscopic skin lesions, and the analysis is on the impact of the skin hair on this diagnosis. So when carrying on the diagnosis with deep learning classifier, we wanted to understand whether the presence of the hair affect the performances of the neural network. The first part is also the final message, don't tear your hair out. So it is a suggestion that there is no need to shave before acquiring pictures to be used to predict the lesion. Why this work? Because the skin cancer is one of the most common cancer in the USA. It's very the number of people going to the dermatologist is increasing year by year, and there is a need for automating and facilitating the screening procedure. For example, acquiring picture and images at home with a smartphone device. So in this setting, it's important to understand whether the presence of the hair affects the deep learning classifier, and therefore, if it's important to shave or not before applying the picture. How we achieved this analysis with four steps. The first one, we collected and published a skin area annotation dataset for the HAM 10,000 dataset. So we acquired some annotation, ground truth annotation, in the green one on the bottom row. And later on, we published it on this URL. And we used this ground truth annotation to train a UNet segmentation network, normally used very popular for biomedical image segmentation, for example, for cell segmentation. And we use it for producing, to train it, we use it for producing a mask for all the skin hair. Then after we learn this segmentation network, we use the learned mask to augment the input images before feeding them to the classification network for predicting the skin lesion. So we devised four strategies: the normal strategy with the input image, the hair augmentation strategies where we transplanted the hair from a random image to the input one, and the same without the original color but with a random RGB pattern, and the last one, the K augmentation with a square of the same number of pixels compared to the mask of the hair. Then we selected three segment classification network, state of the art, ResNet 50, Inception v3, and DenseNet under 21, and we trained those three networks with all the four augmentations. The H, J, and K outperformed the basic one, and also the basic one plus rotation and the translation and the basic augmentations. The final performances, best one is 92% accuracies on the binary classification of NEVI versus melanomas, but actually melanomas versus the rest of the lesions. And what we discover is that augmenting with the hair, the image, has a positive regularizing effect. The same applies for the image without color or with the square. So the network is it's robust to this kind of erasing of the input image. Therefore, the conclusion is that there is no need to shave before epilation, before a classification, and this will lead to better and quicker acquiring of the images and therefore to the patient comfort. Thank you very much for your attention. If you have further questions, please come to the workshop, the live session, or send me an email to a.gallucci@ue.nl. Thank you very much. See you soon. See you at the workshop and have a good holidays.